Sorry, I just got a notice talking to me about being recorded. Anyways, I'm going to present the findings of a survey that we did as a group in New Brunswick, Avenue B, AIDS New Brunswick Ensemble. And so it's a track surveillance project. And the project is about surveying people who inject drugs in Canada. And it's a behavioral and biological surveillance system coordinated by the Public Health Agency of Canada that monitors the prevalence of HIV, the hepatitis C virus, as well as associated risk behaviors among people who inject drugs in Canada. It's a cross-sectional survey that has been carried out every few years at Sentinel sites in Canada. And the findings that I'm going to provide you this afternoon are from the phase 4 that was in New Brunswick in October and November of 2018. And this was the first time that we were participating in this project with Public Health Agency. There were 200 participants that were asked to complete an interviewer-administered questionnaire, and it was covering demographics, drug use, injecting behaviors, sexual behaviors, HIV and Hep C testing, treatment history, and other health services. They were also asked to provide a biological sample. We did a finger prick for a blood sample, which tested for HIV antibodies and the hepatitis C antibody and RNA. And the reason for doing this survey is that certain risk behaviors, such as the sharing of needles and other injection equipment, as well as unprotected sex, are associated with the transmission of bloodborne infections, including HIV and Hep C among people who inject drugs. And the survey results can identify trends and can help inform public health responses to HIV and hepatitis. In New Brunswick, it was carried out under the auspices of the New Brunswick STBBI Community Alliance, which is made up of Avenue B, AIDS New Brunswick, and Ensemble managed the project. So what we found out demographically about the 200 participants between Fredericton, St. John, and Moncton who participated, that 65% were male, and the largest proportion of participants were between the ages of 30 and 49. A large proportion of survey participants self-reported their sexual identity as heterosexual or straight at about 87%. A greater proportion of females than males self-identified as gay, lesbian, bisexual, two-spirited, or other. There was a high proportion of participants at 14.5% that self-identified as being of Aboriginal ethnicity. And that's well above the 3.1% of self-identified Aboriginal peoples among the general New Brunswick population. Almost 3/4 reported that they were unemployed in the 6 months leading up to the survey. 69.5% reported they had been on social assistance in those last 6 months. And then we asked about their housing, and they were able to choose one or more options. So it's not just two answers, but that add up to 100%. So 61% reported living in their own apartment or home, which is stable housing. 54.5% reported living with a family or friend, and we might consider that to be couch surfing. 51.5% reported living in a public place, such as a street, a park, or stairwell. Another 46.5% reported staying in a shelter or a hostel, and 25% reported having lived in a correctional facility, such as a jail or prison. One conclusion that can be drawn from this data is that people who inject drugs are often precariously housed. 29% reported that they had been in jail in the past 12 months, with representation fairly similar between men and women. Another 50% reported that they had been in jail more than 12 months ago. This means that 79% of the respondents had been in jail at some point in their life. So then we went on to talk to them about their knowledge about HIV and hepatitis C testing. So interestingly enough, only 11% had never been tested for HIV. So the others had been either recently tested or beyond the 12-month period leading up to it. But what we also found is they were not very knowledgeable about the HIV pre-exposure prophylactic, we call it PrEP, or HIV post-exposure prophylactic, which we call PEP. And those are two drugs that can reduce the risk of HIV. PrEP is taken before sexual activity with a potentially positive partner, and PEP, on the other hand, is taken after potential exposure. Less than 12% were aware of this treatment, and so it speaks to the need for more education around the potential preventative importance of these drugs. In the test samples that they did, the dry blood samples, there was only one HIV positive person, and they had been aware before the test of their status. Hepatitis C was another story. We had high numbers that had already been tested previously at 89%. And the results of the dry samples taken during the interview, there were 66 individuals who were found to be currently infected with hepatitis C. And of those, 50% knew about their status. 27% who knew their status indicated they were not currently receiving treatment. We went on to ask about trauma in their lives, and trauma has played a significant role in the lives of our survey participants. 80% reported experiencing emotional, psychological, or verbal abuse as a child or an adolescent. 62% experienced physical abuse, and almost half experienced sexual abuse as a child or adolescent. If we look at the breakdown by sex, a higher proportion of women experience these three types of childhood abuses compared to men. So then we went on to ask them about drug use and injecting behavior. And what we did find out at the time in 2018 was that cocaine was the drug that was used the most by 73%, followed in line with Dilaudid at 66%, methamphetamines at 50%, and morphine at 43%. When we asked people if they had used a sterile needle the last time they injected, 94% said yes. However, when we asked who had injected with other used injection equipment, so that would be sharing someone's cooker, for example, 47% reported sharing. When we asked where the location of injection, the number one place was public place. 67% of the folks that we interviewed use publicly because they have no place else to go. Family or friends places was also on the second at 59%. Or in a vehicle at 57%, or in their own house or apartment at 49%. So clearly we see people are using in public places for want of other places to go. When we looked at their sexual activities, the survey results show a high rate of non-use of condoms. 2/3 of those reporting that they had vaginal sex with a regular partner in the past 6 months never used a condom. 73% said they never used a condom during anal sex, and 90% said they never used a condom during oral sex with their regular partners. When we asked those who had sex with casual partners, 37.5% said they never used a condom during vaginal sex, 48% never used a condom during anal sex, and 70% never used a condom during oral sex. So when we look at, their behaviors of using drugs or their sexual activities, and we see high risk behavior happening, so it helps to inform us as we look at programs and services to better support the people we serve. When we look at the use of health service and prevention services, the data shows a vast majority of the participants at 93% use the needle distribution services in Fredericton, Moncton, and St. John. So it speaks to the important role that the needle distribution services play in prevention or reduction of transmission of STBBIs. Almost 60% of survey participants, both male and female, report that they have used methadone or other opiate substitution therapy in the past year, which means that they have sought help for their opiate addiction at some point, but may still be injecting other drugs. There is no supervised injection or consumption sites in New Brunswick. 21% of those reporting Indigenous heritage had sought help from a traditional healer. So we have some key messages that we pulled out for healthcare professionals, and that was people who inject drugs experience a lot of stigma, discrimination, and a significant proportion reported that they had avoided healthcare services for fear or concern about stigma by staff. This speaks to the need for healthcare professionals to be mindful of the ways in which they talk in and or treat people who inject drugs, because it can discourage them from using the services. They need to offer trauma-informed care. They also need to understand the nature of the injection drug use by their patients. Other key messages for nonprofits and healthcare professionals relates to what I mentioned earlier about PEP and PrEP. It needs to be provided to people who use drugs as an effective prevention resource, and treatment needs to be accessible. Of survey participants, 88% had heard about take-home overdose kits such as naloxone or Narcan. 79% said such kits were available in their community, yet only 13% said they carry an overdose kit. So we need to do something better about the promotion and education to ensure that they do receive those kits and the training that goes with them, because we know that those kits can save lives. So in conclusion, well, the key messages are based on the prevention of sexually transmitted and bloodborne infections through non-judgmental healthcare services and education. There is also an indication of the need for stable housing and a safe place for drug use. The TRACS project provides information that will help to guide ongoing delivery of programs and services for people who use substances. And additionally, it will be used to educate and advocate for a public health approach to support New Brunswickers who use substances. So that's the report in a real quick nutshell, but to know that the materials have been uploaded to the website, and I believe the staff will provide you with the link. And so there's a copy of on English and en français of the report, and we also have a poster that summarizes it. So we're happy to have you take that information and share it. And if you have any questions, you can direct them and hopefully we can answer them.
Wonderful. Thank you so much, Debbie. Really appreciate that presentation. And I'll definitely be looking at that report, which I think a few people shared in the chat.